So, in the virtual world, there are probably more specific ones because you can certainly narrowcast a lot easier in a national audience than you can in a local audience. Certainly at the local thing, which, we talked about a little bit, but not at great length, they aren't narrowcast. It's too hard. There's not enough of a population of lung nets to have a lung net local group. So our group supports lung nets, it supports PNETs, it supports GI nets, rectal nets, paraphios, although, certainly there are national paraphio groups as well. But honestly, we support all of those and we learn from each other. We run now virtual Tuesday, Friday support groups. And on Tuesday, we had a lung net who said, look, for the most part, I don't, a lot of what's talked about, I don't really follow because it's not applicable to me. But there's those moments in time, like listening to issues with imaging and misreads, or how to ask for rereads, that are so important to me, that I've learned so much, that even though I'm a lung net, and even though, some of the speakers that we have at our thing don't touch lung nets, I learned so much just by being part of this community. And so while not at the local level, these things are not narrowcast, understand that you can learn a lot on how to understand your care, even if it's not narrowcast. So that's an interesting question. Tumor tissue registries. So what will be important? I was asked this by some researchers actually earlier this week, and I have a call at 3 o'clock on this later today. So, there's a lot of different work going on in this area, and it hasn't yielded a ton of fruit yet. But there are various net cancer registries. There's pattern.org, where those who are having surgery can certainly send their tissues so that it can be used for research. And the role of the support group isn't for us to, analyze tissue types, but more provide, much like we did in that when I was talking about the NRC, is to provide that information of what's available out there, how many places can do this, or where to go if you want to submit your tissue for research, and where to go to sign up for registries. And really, we haven't had great success with cancer registries yet, but I know that there is work underway. We do really good in this group in surveying each other to death, sending out surveys and trying, but these are points in time and they don't really give us actionable data. And I think we'll start seeing more maturity and more long perspective studies with registries, or studies with patient-reported outcomes in the very near future. Stay tuned for things happening in that space. And the role of the support group really is to, when these things come around, is to help promote them and help make sure that if people are putting forth the effort to do good work, that we can support it. I think one of the roles in the NCI clinical trials, the NCI task force or steering committee, is really trying to understand whether clinical trials can recruit. And how, when we put the best clinical trials forward, how to make sure that those are, those are available to patients, and that patients understand their availability. And I think that's another area where support groups can help advance information and make sure, because the worst thing that could happen is that we have good trials that might change the dial on patient care, but we can't recruit to them because no one knows about them. Most of the things that you hear about that are holistic or alternative really aren't about, if they're about curing cancer, it's most likely they can be debunked and don't have really great science about them. If it's around supportive care, there's lots of really great supportive care things that can happen in the integrative world. And you should actually talk to either an integrative oncologist or an integrative practice, and make sure they're research-based. And since we're going to throw out some more sites and you'll do it, one of the greatest resources, if you're looking up herbs or other things and you want to understand really what's done for them, Memorial Sloan Kettering runs a botanical resource page where pretty much any herb or any of those types of supplements, you can look and see what the science is behind them and understand what they are before you go take them. And I really recommend going to look at that. One of the books, there's an anti-cancer series that was done by David Servan Schreiber, also by Lorenzo Cohn, who's at MD Anderson, on understanding integrative therapies and integrative approaches to keeping your body in wellness, and I really do recommend them. So, and in the anti-cancer, A New Path Forward, or the seven, it's the one by Lorenzo Cohn. There's actually, since Lorenzo and I are friends, I'm actually in that book as how to work in the integrative space and use it for supportive care as well. I went through PRT, it's pretty well known, and I certainly used restorative yoga to overcome fatigue. No, it's not going to cure cancer, but it certainly got me out of the rut of being fatigued all the time after my first and fourth treatment. And there's some, so there are some good areas in here, but you're not going to cure cancer. This is really at best supportive care. And anything that says they can cure cancer and multiple diseases, every hair in the back of my neck stands up. Well, I mean, so look, I meet a lot of people who have cancer, who have severe depression, or who are depressed, and we're hitting a couple double whammies here. We're given this life-altering thing that's going on, and I know from personal experience, when I was diagnosed, my GP wanted to give me Ativan, and you can tell I usually manage pretty well here, and so it's how this impacts us is all different. Those with carcinoid syndromes may have some extra challenges with some extra hormonal release, and this is back to really talk to your doc. And really, this is something, and if your oncologist isn't interested in having this conversation with you, ask about palliative care, ask about pain management, but mostly ask about palliative care, because or integrative oncology, because they'll work a little bit more with the whole you, and try to make sure that all of your needs are getting met, just not your disease needs. And so while I don't know any of the complete statistics there, I would really suggest that you broaden your care team to include those who might look out for that part about being depressed.